When I was first approached, I was very impressed with the service and the sounds that we were given. We were given a number of examples, and immediately I felt that this could be very beneficial in some parts of the hospital. And so I worked with a member of the company, and we had a further listen at what other hospitals had done elsewhere. I was also aware that the company were rolling out through the country in trusts, and for me that gave some assurance that clearly other hospitals were finding this a good product. So that's what initially sparked my interest. Initially, our plans were to have it installed in two main areas, which was our entrances at the front and back of St Peter's. Very quickly, we moved up the instalment to 8 areas, both here at St Peter's and Ashford. And the reason for that was because I'd recognised very quickly that we needed to get messaging to patients and indeed staff on a number of things, and in particular things around the COVID. So actually our installation process was sped up very quickly. So we've got different messages within different parts of the hospital. So just to give you an example, so in our main entrances of our hospital, we've got lots of what I would call visitor type messaging. Welcome to the hospital, particularly with COVID, lots of messages about please, maintain 2 metre social distance, wash your hands, etc. But also what's been really important is because of some of our visiting restrictions due to the pandemic, we've been able to get that very clear to visitors at the very beginning. After a while, the visitors obviously ceased because that was the whole idea with COVID, but we could pre-warn patients and their families and loved ones that this was on its way. So for me, that was very important. The other point of the announcement system was that we could also remind staff about things, activities, events, and again, things around infection control principles. So, when you're in health industry, sometimes it's easy to forget, particularly if you're working on busy wards, things like the 2 metre social distancing. So right through the hospital, we've got staff messages that are very clear, very punchy, which reminds staff to keep their social distance where possible. The other point from a patient perspective is what we've got in ED. So the system obviously works with our wait times, and this is very important, particularly because we know that people come to the emergency department for primary care type conditions. So actually by announcing, there's a 4-hour wait, or indeed there's a 6-hour wait, some patients or their families may indeed be able to say, well, think about actually going to 111 or whatever. We're already starting to think about that now, and the hospital as a whole is actually thinking about how we deliver services in the future. And we are going to do things differently because COVID has naturally put us into a different place. So a really good example of that is our outpatient service. So we have a huge footfall through both hospitals, people coming to appointments, physically, and actually we've realised, like a number of hospitals across the country, we don't need to do that. We can actually do outpatient appointment through video or telephone consultation. So for example, messaging around that will be really important, and that will be important for staff as well, because staff need to understand that we won't be doing the face-to-face traditional anymore. So that's one good example of that. The other example is at some point we'll probably resume sort of back to normal staffing. And we're not saying we'll have all staff back working on site, because I think again COVID's changed us and we'll be thinking about teleworking and remote working, but actually to keep staff updated on things that are happening and how we're going to do things in the future is really positive. And then finally, my last sort of idea immediately in my mind is actually to use the system to announce events, study days, conferences. So one of our systems is installed in the postgraduate education centre, where all the staff have their hospital food and etc. So actually we can advertise things like that as well. Actually, the process was fantastic. As soon as we kind of put our thumbs up and said we're going, the team came down very quickly. The guys that physically installed the product, it was very simple. They worked with our estates team. The products themselves are very discreet. They're easy. They tap into our existing systems. So there wasn't a big works kind of setup where, you know, corridors were stopped, etc. So the team were excellent with that. The other point really was that how the product is controlled through the set, really, the volume on off. You know, they consulted with me what would be best, where should be best, how can we place this. Because obviously I had to think about 8 areas and how that was going to be controlled, and what I didn't want, for example, are things like volume being turned down or, you know, difficult access, and actually it was all done very easily. Just to give you an example, so we had a 2-minute silence in recognition of NHS workers who'd sadly passed through COVID, and so we were very quickly able to switch the system off, just to respect that 2-minute silence and switch it back on again. The other point was that actually as we installed, what we did realise is because people can access this, sometimes there is a tendency to turn down, but obviously the company were very good and delivered us some cases with secure locks on, so actually we could control that a little bit better as well. So that was the installation piece. Background music, again, when it first started, it was really interesting because it had completely changed the atmosphere in this hospital. I can't really describe it, but I remember coming in that first day and hearing music, and quite a lot of people said to me, wow, this is incredible. It just kind of changes what it feels like to come to work. And I think it's an anxiety thing. I think it's a relaxation thing. I've spoken to the receptionists particularly because they're sitting under the speakers, and I've sort of said, how is it for you? And they've actually really liked it, and they've said they've really enjoyed it. And what I have liked as well is if I've wanted things changed quickly, maybe a message or indeed some of the background music, again, the company's been very good at kind of responding very quickly to that. So I had a couple of comments that somebody said it was they didn't like a particular sort of theme of music. That's now been changed really quickly. So the responsiveness has been really good with that regard.